Hey everybody, and welcome to the channel. My name is Dr. Todd. I'm an internal medicine doctor working in primary care. This is my wife Allycia.
Hey.
This is our very first ever reaction video. We're going to be watching the show The Pitt on HBO. I've heard very good things about this. It is a medical show, which is hence why we're reacting to it. But what makes this show intriguing is I've heard that this is quite real. Or at least that's the reputation that it has. This is maybe the most realistic medical show. Let's get right into it. The Pitt. So my suspicion was that it was set in Pittsburgh, given that it's spelled P-I-T-T.
I just thought it was like the pit of like the emergency room or something.
Well, maybe it's a double meaning. But that's definitely Pittsburgh.
Okay.
The yellow bridges, and it showed Heinz Field where the Steelers play. We're Bengals fans, so this will be interesting. So the main character, who looks like an ER physician.
Why do you think that?
Oh, he just has that swag. That's how and they walk in with a bag over the shoulder. That's an ER doc.
Is it?
He's got the earpiece in. Although he's not drinking a Diet Coke.
Never one of your patients.
Yeah, I think every single doctor who's ever trained in the hospital has that one place that they go, like if they just need to get away for a minute, because you do see things and it does affect you.
Starting today, so good luck with lucky me.
So it must be July 1st. Pro tip: try not to go to the hospital in July. That's when all the new residents start. I'm just kidding. I mean, go if you need to, but
Yeah.
I have some student doctors with me today. Do you mind if they observe?
that was very appropriate. Ask for permission. Ooh.
And the fun begins.
So hand burns are a big deal.
Really?
Yeah, it's because of obviously how much dexterity we have with our hand muscles. So you take hand burns very seriously.
Actually, this is the most important person that you're going to meet today. This is Dana. She's our charge nurse.
That is true.
Another two of the Realism.
Well, alcohol withdrawal, you can go into something called delirium tremens, which is basically a seizure, but you start to get shaky. It's deadly.
Degloving injury, right lower leg with open fracture dislocation of the ankle.
Pimping the resident in the middle of the. I mean, no, that's what they do.
Yeah.
Got to make sure they learn. Helps to learn a little bit when your feet are in the fire.
I mean, she's been a little dramatic there. Just kidding.
I wonder what her pain level is on the scale of
Yeah.
10. Surprised.
Just a 7.
Surprised nobody's asked her yet.
Any pain in your chest or belly?
Oh, I thought she was actually asking her if she's in pain. I'm sure that's an administrator.
I mean, how could he not have time for her?
Probably wants to talk about some hospital initiative.
Take it you're free now?
I like though how his PPE is like draped off like
I
that.
know.
No, but that's very accurate.
Oh.
Like when the attending comes in, they just kind of put it on a little bit.
Patient satisfaction?
Oh yes, patient satisfaction. Press Gainies. Yes, please tell us all about that.
Do you know how likely patients are to recommend this hospital?
This is an emergency department, not a Taco Bell.
There's a nursing shortage across the country.
Because you're not paying them enough.
The beds are right there. You just don't want to hire the staff you need to care for.
Oh.
It ain't working. And whatever they're giving me, it's not working.
Should I send in the fleet?
Constipated. They're about to make it rain.
Down here in the pit.
Down here in the pit. See?
Yeah. Play on words.
Other hospitals are managing this crisis much more effectively.
I'm just confused why it's his fault that the hospital is not managing this effectively.
Yeah. Ready?
Yeah, I don't know that this is going to work.
Med student down.
Med student down. I almost passed out once. It was when I was a med student.
Yeah.
I really didn't do well seeing people in pain. And so it was like my first encounter seeing somebody like real pain, and it made me really uneasy. Thankfully, over time, you kind of get used to it.
Otis? Otis? Didn't take him for a lightweight, huh?
This is interesting. I mean, it's not uncommon to pass out when doing blood, vagal, but this obviously looked a little more dramatic.
Yeah, he did not pulse.
Well, yeah, and then he has no pulse.
B-Tech. Charging at 200. Charge.
Clear?
At least they didn't do the paddles for like asystole, because a lot of like medical memes make fun of shows for doing that, because there's only certain rhythms that actually you can defibrillate.
Oh, okay.
Has anyone notified the family?
Looks like you're up.
B-Tech arrest 2 weeks after triathlon.
After a triathlon.
Charged and clear.
So it's interesting. He's going in and out. Sounds like he already knows what's going on.
What are you doing?
1 gram calcium glutamate IV push.
Probably from rhabdo. Yep. So like intense exercise can break down muscle tissue, releases something called CPK, causes a condition called rhabdo.
6.
You
High
need to be
potassium and
dialyzed.
renal failure. Just what you thought.
Must be my lucky day. One of the things we do here is to take a moment of silence when we lose a patient.
Yeah, I mean, I think that's actually really cool that he did that, because sometimes when you're in the hospital and it is a fast pace, you know, sometimes you view yourself as just treating diseases, but you are treating people. You're treating someone's family.
It's rolling earlier, so he was gonna be okay.
Yeah, maybe that was foreshadowing something bad.
Potassium 3.1.
Is that bad? Can cause heart problems, but we're
It's
gonna
low,
correct
but
it.
it's not that low.
Weird.
What about gummies?
No, we're very
THC gummies.
right?
Your brother, he some gummies he got in Cleveland.
I think that's a quick way to get divorced.
Thanks. I appreciate that quick turnaround.
Child Protective Services. Oh, that wouldn't be funny or fun to be the actor that played that little boy who just lay in the bed. Don't move, just lay in the bed, keep your eyes closed.
I sharded the first time I saw an emergency C-section. Really? Of course not.
Oh, is he about to have a panic attack?
Looks like he's starting to feel the effects of maybe losing his mentor.
Mm-hmm. Oh, COVID.
Oh.
Oh, interesting.
All right, so you may notice that we look a little different than we did when we were watching the show. That is because it is 1 day later, 24 hours later. Felt that it was important to sleep on it. It was actually quite late when we finished, to kind of give it a moment to marinate, process everything that we just witnessed, because it was a lot. And I took notes. So
Got his handy dandy notebook.
yep, which I think keeps me on track. I think because there are some things that definitely need to be, I think, discussed. I think that was the point of the show. I don't know. Before I get into my thoughts, did you have any thoughts? I mean, are you happy with the direction? Are you excited to see what happens next?
Yeah, I'm actually intrigued from the ending,
Yeah, that was
and I want to see where that goes.
yeah, that was. I
I
think
mean, obviously we know where COVID-19 goes, but
yeah, that was a big. I think that was a pretty emotional ending, actually.
Yeah.
Frankly, so then I wrote that down. That's bullet point number 4. So I think I liked the show. Now, granted, I mentioned before the episode, I've not really watched a whole lot of medical shows. So to be fair,
I mean, that really is saying a lot
yeah, like I don't.
for you.
Yeah, and I don't have a lot to compare it to. Every show, though, and movie, well, I shouldn't say every, but there are a lot of shows out there that have medical scenes in them, right? So the show may
Yeah.
not be medical related, but there's medical scenes, and they always get it wrong. Like they take the stereotypes of medicine and then they just amplify them and embellish them to the point where they're just not believable or recognizable.
Did it make you miss those days in the hospital?
That's a loaded question. There were moments that took me back. You know, I think I made this comment, like, you know, the beginning where it shows the doctor who's out there on the roof. I don't know how they all access the roof in these shows. Like, I've seen scenes
You
from
guys weren't just sitting out there on the roof
no
contemplating your day?
no, I don't think that was I don't think we ever had access to that. We did have a flight pad, but we couldn't access that. So I think that, like I mentioned, every single doctor I think has that place in the hospital that they can remember that they escaped to, like when things got hard or overwhelming, or they just lost a patient and you just needed a moment. Maybe it's just to, maybe it was to cry, maybe it was to, I don't know, just stew, vent, whatever.
Do you remember any moments that you had to escape?
Yeah, I mean,
Any specific that are gonna make you want to cry right now? I was kidding.
no, nothing's, no, I mean, maybe we'll get into that as things go on, but
He doesn't want to talk about it.
yeah, no, there were definitely moments though where you felt like you lost, or you felt like you were defeated, and I think that's what they displayed there in some of those scenes. I thought the main character is I like him a lot. I think his character is relatable to almost anybody in the healthcare profession. That sort of, I'm here for the patient. I'm not here for, certainly not here for the administrator. So they played that up, with the administrator coming in the middle of a busy ER day and saying, hey, what about your scores? What about your patient satisfaction? I mean, and by the way, that absolutely happens, which is extraordinarily inappropriate. I think some of the other subtleties that I picked up on that I really liked. So I thought, and I mentioned this too, I thought it was really cool when he stopped everybody after that patient had passed away. They stopped doing the code, stopped doing the chest compressions, and made everybody just take a moment. And you saw, like, one of the residents was kind of annoyed by it, right? It was like,
yeah. Like, we don't have time for this.
Right. And I, I think, and I see that, and I'd be lying if I said that I never became somewhat desensitized in my time. I can actually give you an example. I wasn't so much being desensitized, but just shows you the stark contrast of what a night in the life of, say, a doctor who's working in that type of setting. We actually had a patient who passed away who coded. I was part of the code team. I didn't know the patient until I arrived at the bedside in the middle of this acute event. They'd actually were hemorrhaging from their esophagus and were vomiting up blood, and then went into cardiac arrest. And we did the code, and unfortunately, the patient didn't make it. But we worked it for 30 minutes to an hour, trying. Kind of getting some activity back and then losing it again. And then I remember the family, like I said, I had never met the family, hadn't even met the patient before that, had come up after. It actually gave me a hug, thanked me for, trying. And then I got paged almost immediately after, because the patient was very upset with their dinner.
The patient or a different patient?
I'm sorry, a different patient. Okay. Sorry, yeah, I got paged because... And most of the time, nurses aren't going to bother you with that kind of stuff. But this patient was being very sort of belligerent and demanding to talk to the doctor. And so I had to go there maybe 10 minutes later and hear them complain about, I don't even know, cold potatoes or something. And it kind of put it in perspective. And look, that's not to say that I've complained about really silly things before too, right?
Oh, yeah. We're all human.
Right. I'm not trying to say that it's
I think you're trying to say it's a hard, balance to go from something that's so, what would you call it, acute?
Yeah.
Like an acute trauma. I mean, obviously the patient died.
Right.
That's the worst outcome that you could have.
Right.
But to go from that to dealing with a patient who's upset over their potatoes or...
Right. Yeah. It's just... And I think, and if anybody out there, I suppose, is watching who's worked in the hospital, share a similar story if they've had that, because I'm almost guaranteed everybody's had something like that where you're just baffled by that.
Well, and I know you've even said that it's hard sometimes, like when you were working in the hospital, to go from that and then coming back into our home.
Yeah.
And just me complaining about you helping with the dishes.
Yeah.
You know, trying to flip that switch into husband dad mode.
Yeah.
You know?
I do, and I think you see that in like military personnel too, right? Like coming home from war. Not suggesting that working in the hospital
Yeah,
is
but it
equivalent
still
to war,
can be
but
traumatic on your mind.
yeah, but coming home and then seeing the things that we sort of take for granted, the things that we complain about. So anyway, I think him taking that moment to say bring it back to the really what the point is, right? This is what our jobs are, and this is what we're trying to save a person, right? It's not just about treating disease, right? Like the patient walks in, it's not, oh, this is heart failure or pneumonia, cellulitis. No, like this is a person, and that's who we're treating.
Yeah.
So I thought that was really cool. I also wrote down they made the comment. We see this in medicine too. One of the things I wish we would change is ego in medicine, and you see this. It's almost like these pissing contests amongst different providers sometimes and specialists, and sometimes even nurses and doctors, and you see this. This show did a pretty good job because there wasn't any like really overt egos that kind of got in the way, except so when the patient that came in from the nursing home and the doctors were complaining, or the nurses or whoever it was complaining about that nurse from the nursing home sending this patient without like the code status.
Oh yeah.
And I think the charge nurse had even said, that nurse called the ambulance so that they could take care of the other 50 patients on their understaffed wing. And I liked that because it's, again,
Just brings you, humbles you.
It's like, yeah, okay, I get it. This is rough, but that person's going through this too on the other side, right? Because at the end of the day, like staffing issues are a big deal. I mean, he alluded to that with bed space and shortages.
Yeah. Well, that's what he said, that there was space.
Right. We just weren't paying to staff them.
Yeah.
Essentially, is what we're saying. Because at the end of the day, the bottom line meant more than patient outcomes or the burnout rates of your doctors and nurses. So that's something I think resonates with almost anybody in the healthcare field. And then lastly, I think kind of just ending this off was that ending scene.
It's pretty powerful.
Yeah, it was a shock because I think it brings you back into those moments. And I didn't work in the hospital. My hospital days were behind me when COVID hit. I certainly saw it from the outpatient angle, right? I saw the isolation, I saw the depression, I saw all of the carnage that it took place there. I can only imagine to those who had worked in the hospital during that to have been kind of flashed that view. I can only imagine that was pretty triggering.
Yeah.
Probably pretty emotional for a lot of people. So, and clearly this, I think, is tying into his mentor. I guess it was his mentor that had died. And my guess is it was perhaps it was of COVID that actually took them, because, they were working in these centers that were, again, severely understaffed. They were underprepared, didn't have the proper equipment. It was just a really, really trying time. So powerful image to end. I'm curious, we're getting ready to get an episode 2 here. Actually going to shoot this shortly. So if you enjoyed this, consider checking out episode 2 with us. Excited to see where it goes. Please also consider giving us a like, a comment, a subscribe. Help us kind of grow this thing. I don't know, any last thoughts?
No, I'm just ready to get started on episode 2.
All right. Well, hey, we'll see you then. All right, guys. Take care. When's your next checkup?